All right, welcome everyone. We're going to give everyone a few seconds to join in. And thank you for taking time out of your day. I'm Dr. Katie Woodley, the natural pet doctor. And I'm so excited for today because I am excited to learn more about Gua Sha and hear about all the cool things that Dr. Tori is doing for animals and paving the way with this really neat ancient remedy. So as you join, there is the option to put in your questions down below in the Q&A box. So as Dr. Tori is talking, if you have questions, pop them down there. We'll kind of wait till the end to go through them, and then we'll see kind of what time we have left over. And of course, you'll get the recording too, so you can rewatch this in case you missed something that she said. And we'll, of course, link back to Dr. Tori's details. So I'm going to start with a brief introduction for Dr. Tori Countner, because she's just an amazing person. I feel very blessed to have crossed paths with her, and we've done a couple webinars together, which is super exciting. So Dr. Tori Countner is an integrative veterinarian in Southern California and founder of Balanced Pet Vet. She strives to make natural medicine easy and simple for pet parents to incorporate into their daily routine. Dr. Tori's passion lies in pain relief for pets by using acupuncture, laser therapy, and now Gua Sha, which she can teach to clients and pet parents for better health at home. Dr. Tori lives in San Diego with her husband and her 2 dogs. And if you're not already following her on social media, make sure you are following her because they are the most adorable dogs. And I love seeing what she does and all the cool recipes and all her cute videos that she incorporates with her dogs. So thank you, Dr. Tori, for being here. I'm so excited for you to be here.
Thank you so much for having me. I mean, I love that we've never met in person, but I love,
one day.
Yeah, that we can be colleagues, through the internet, because I learned so much from you and your community as well. So yeah, it's fun to connect and kind of join forces and continue to teach the masses.
Awesome. All right. Well, let's just start with like the very basic, right? So what exactly is Gua Sha?
Yeah, so Gua Sha, it's been used for over 2,000 years. It's part of traditional Chinese medicine, so TCM, and it's a massage technique. And they actually, you can see this tool right here. It's kind of like a cold stone tool, and I can go into the different stones later. But basically, it's a stroking motion of along, well, I'll say, humans, but along animals or just the top layer of the skin surface. And what that is doing is basically you like rub or scrape or glide along the surface of the skin, along usually like the meaty parts. So, trying to avoid bones, but it helps release stagnation, or it helps kind of decrease muscle tension, however you want to think about it in your mind, but it opens up and gets that qi flowing or gets your circulation flowing. And so by this simple act of scraping along here, you're getting those, those small little vessels, the fascia and the muscles underneath, and you're really just releasing tension, easing pain, like I said, circulation in terms of blood vessels, lymph, nerves, all of that basically live in the surface of your skin, but it also gets down to those deeper muscle layers. So it's basically like a type of massage, but it's, without using your hands and using this stone, it really gets to those kind of surface areas where the fascia and all those connective tissues, blood vessels, lymph, all of that live.
Awesome. Yeah. And so what's interesting, I found out about it through my own acupunctures for humans and also seeing all your stuff, but I use it on my face. Like, I think that's a common area where a lot of human side of medicine is using to get lymph flow. And I know when I run along like my jaw and I get like back here, it's like, oh my goodness, it's really tender.
Exactly. It's like, it's so tender. And so, yeah, so it came about and I learned it from it through my human acupuncturist. And just like a lot of the beauty blogs out there.
Prevent the wrinkles, right?
Exactly.
Like the sagging of the skin, losing collagen, right?
Right. And it's, it's the same principle of like, you're moving this tool along your face to smooth out that connective tissue, that collagen underneath, which helps promote blood flow. So, good nutrients in, they take the waste product out. And it does help with wrinkles. So it's like, great, if this can happen to my face, imagine what it can happen or what can happen with our animals that are painful, stiff, like chronic immobility, chronic issues, inflammation, all of that. But it does really help. And I, like you, I probably hold a lot of tension in my jaw. And, when I move the tool up, it feels so good. And it's so relaxing, that, that in and of itself, if that's like what you take away from doing, this webinar, just like the facial Gua Sha, it really helps relax, ease tension. Your face looks brighter, more awake, and you feel a lot better. Just kind of like clear the day's worth of, headaches away.
The stress.
Yeah, exactly.
That's
so
awesome.
It really gets at the fascia, which is the connective tissue that basically lines our entire body. And, we kind of, I don't know about you, Katie, but we kind of learned about it in vet school. We could see it, we knew where, it laid, but we really didn't get into it. And the more I've researched about it, there's a lot going on in human medicine right now, where they're calling it like the biggest sensory organ in our bodies, because it envelops the muscles, tendons, ligaments, lymph structures and vessels, blood vessels, nerves, and they're seeing it kind of conducts and talks to each other. So, if you can ease your fascia, that thin kind of like saran wrap layer underneath your skin, it really can do wonders systemically, locally, for us and our dogs.
I love it. Yeah. So leading into the next question, so you kind of touched a little bit on it with like pain and older pets, but what can we use it for? What can pet parents, so say they have an older dog, or even if they have a younger dog, what are some of the different uses that you're using Gua Sha for?
Yeah, so mainly I do a lot of pain management, so it's a lot of pain, but with that comes stiffness, tightness, mobility issues, so unable to really flex and extend joints. So I mainly use it for pain, inflammation. It can also be used for anxiety or just calming down the nervous system. And I find that is really helpful, again, with older dogs that are a little bit more painful, maybe a little bit like more geriatric, that have some dementia as well. They can get anxiety, and that helps calm their nervous system. Immunity. So this is a big one. It helps, again, with blood circulation, which helps bring in nutrients, take away waste products. And it also helps with lymph drainage or lymph flow. So your lymphatic system, it doesn't have a pump like the heart does. So it relies on movement and massage to get the lymph flowing. And a lot of these older painful pets, if they're not moving a lot, if they're just like super stiff, their lymph flow isn't moving as much. And so they can get stagnation in the lymph system. They can get edema or swelling. So by using, this tool and certain strokes, you can really get the lymph system to move, again, bringing in good stuff, taking away bad stuff, and just overall balancing immunity and fluid balance as well.
I love that. I mean, I talk about detoxing all the time because we're constantly bombarded by toxins in our environments and food and all sorts of things. And, I think this is a great, easy way for people to help their pet detox every day or a couple times a week, alongside feeding an appropriate diet and other ways. So you probably treat a lot of cancer patients too. Do you find that it helps with like their appetites, especially if they're going through chemotherapy or they're just battling things like lymphoma, right? The lymph and everything is being affected by that. Have you used it in those types of patients?
I definitely have. I've been a little bit more careful with my lymphoma patients, because just like looking at the literature and trying to figure out, is this safe? But I also weigh like quality of life, chemo side effects, to I do believe it is safe, but I just want more literature to back that statement up. But I definitely see them, in broad terms, I see them relax more and they're happier when they walk out of the office. And so that to me is a huge win. So, if they're relaxed and happy, yes, their appetite is better. They have a little bit more energy. They usually, and I've had clients say this as well when they do it at home, they, go outside and pee like a big amount afterwards. So, yeah. So it's like you're moving the fluid. So, something's going on physiology wise in terms of getting that, the stagnation out, and they feel better, more relaxed, more themselves. And so overall, I've seen, like an uptick of improvement, especially like you said, with my cancer patients that are on chemo. That's been extremely helpful, especially during times of COVID, where they can't come into my office and get acupuncture. We'll, either do like a Zoom session, or they know what to do in terms of strokes with the tool, and, help the dog or cat, afterwards, after the chemo, just kind of reset and help balance their body. And it definitely minimizes side effects, in my opinion, for sure.
Yeah, that's great. And you probably do more dogs than cats. It tends to kind of seem like the theme when we're doing acupuncture, but
Yeah.
how do cats respond to this?
The cats actually respond pretty well. I do a lot lighter pressure. But a lot of cats, they definitely do well. Just like in acupuncture, like if you can get the needles in, they respond beautifully. And I find this is like a little bit easier because I can do a couple strokes, the cat can like readjust and, move around the room and do a couple more. But I also find that owners are able to do it a lot better, than in the clinic. At home, the acupuncture, the Gua Sha on cats. And it's really, it's wonderful for them. And especially during these hot days, you can put the stone in the fridge and kind of have a cooling effect as well.
Point.
Yeah. And for the chronically, cats are just so hard when it comes to appreciating arthritis and pain. But for those like old creaky cats that are cold, I'll kind of, I'll warm this up a little bit. I have like a little mini fridge here that does warming also. So I'll warm up the tool and try to, do warmer strokes on those areas that are super chronic, really stiff, cold. And that helps loosen up the muscles as well.
I love that. So everyone's probably like, okay, right? They're like, this is so cool. This is seems so easy to do at home for dogs, cats, whatever you have, right? So what's an easy way for pet parents to get started? And maybe touch on a little bit about the tool now, because I know there's some really neat properties with different stones, and also the shape matters too, from my understanding.
Yeah. So it depends. I tell people, like, this is a basic tool. This is heart shaped and this is rose quartz. So I usually start with this tool, and this is the flat surface that I can use, from anywhere from a Chihuahua to a Great Dane, to cats, anything like that. And so rose quartz, that is more of like loving and kindness and self-love. So, if you have like an anxious rescue dog or cat, I tend to use, rose quartz. It can be calming after trauma. So a lot of dogs, that are rescues, or like I have a hit by car dog that had surgery, and he's just like kind of a different dog. He's a little bit anxious. And so to help with that, I use the rose quartz. There is also jade, which is a green color. And that is more like balance and harmony with mind, body, soul. And it's like healing energy. A lot of it can have something to do with the internal organs. So, I see a lot of, like you said, cancer patients, kidney issues, that type of thing. So I'll use my green jade stone for that. And then there's Bian stone, Bian stone. It's a black stone. And that was from like a meteor that hit the earth, thousands of years ago. So it has like over 40 minerals in there. And it's said to have like healing properties on a cellular level. So, that's wonderful for, again, overall healing, post surgery. I see a lot of TPLOs as well. So that's a good stone to use for that. But you really can't go wrong. So I would start, with this heart shape. There's also some teardrop shapes. This I got from Herbivore Botanicals. The Bian stone, I like Wildling, and I think I'm going to do a giveaway with them next week. But that is the black, and it has a serrated edge. And that's really good to use on scar tissue once the site has healed, because with scar tissue, the fascia and all that connective tissue kind of bundles up. Again, with like TPLOs, back surgeries, any type of surgery. And so you want to keep that fascia, the connective tissue, vessels, lymph, nerves and everything really smooth and soft. So that's a good way to kind of break that up. So those are the tools that I use. So this is the heart-shaped one. And so I tend to use this curved area when I'm just doing maintenance. And you want to go not perpendicular, but at a 45-degree or less angle. And you want to go with the fur and just gently stroke along with the fur. Doing perpendicular, that's not going to be wrong, but you just get more surface area with that lesser angle. I tend to take my other hand and anchor above where I'm doing the strokes because their skin can bunch up a little bit. And so we want to stretch and compress that underlying fascia tissue. So that's why I anchor the skin above so I can really get into those strokes along the back, along the neck, thighs, anywhere that they are either sensitive or for maintenance, whole body is good to do as well.
Would you, if you're doing this along, so backs, right? As we know, they get so tight and tense,
yeah,
especially, older patients. So if you find like the pet parents doing this and they're going along and they're kind of reacting, they're moving away, would you use less pressure? Would you move to a different area?
Yeah, I would definitely use less pressure, see how they react, and then I would move to a different area if they're still super, super sensitive right there. Because as you know, the back is basically connected to everything. So even if they have like a front limb issue, back limb issue, the back and the spine is going to be affected. And I find that lumbar, that low back area is super, super tight. So they can be really sensitive there. So I would do less pressure. It's kind of hard to, show over Zoom, but I encourage my clients to do it on themselves first to see how does that feel? Does the deeper pressure feel good? Smaller dogs, you want to do a little bit less pressure because there's just less thickness right there. But yeah, if they're moving away, if they don't like it as much, then I'd move to a different area or definitely just do some lighter strokes around that area for sure.
And I know a lot of people here are super fascinated or even using more holistic remedies for their pets. So if they're already getting laser therapy, they're getting acupuncture, chiropractic care, where would this fit in with that?
So this fits in because, I do acupuncture, laser, I don't do chiropractics, but, I refer out, even massage. This gets at the surface of the area. So it's similar to foam rolling or even cupping. If any of you have done that, I know that I foam roll my IT band after I go running, and it hurts, but it's a beautiful hurt. But so this gets more at the surface of the skin or the surface connective tissue, which massage, it's sometimes a little bit deeper. Acupuncture it can, but it doesn't really smooth out that fascia that lays right underneath, your skin, over your muscles, and houses all those vessels and nerves and everything. Chiropractic care is the same thing. It doesn't get at that fascia. So this and laser can help, but again, this really smooths out those adhesions, those wrinkles. I kind of think of it as saran wrap. So when saran wrap gets totally bunched up, you can massage it, but I want to smooth it out so it's super smooth. And that's why I use this tool. We can't really use the foam roller on our dogs.
I saw one of your videos showing that. So
yeah. And cupping, you would have to probably shave the fur to get a good suction.
They would not do well with that.
Oh yeah.
It would be a nightmare.
Yeah. And so, I have clients, I see them once a week, and I'm sure your schedule is busy too. And it's even if I want to see you twice a week, it's really pushing it. And, but also a lot of people are traveling with COVID. A lot of people didn't want to come into the office as much. So this is great for I do this a couple of times a week on my own dogs, and they're young and they're not showing any signs of issues, but I want to keep their fascia, their lymph system, their circulation. I want to continue to help balance their body and prevent any issues with this tool. So, and if you have a specific ailment that, you're seeing your patient for, you can say, okay, the 3 days in between our next appointment, do this for X amount of time on that back leg or just full body, because again, everything is connected. So that's where this fits in. It's just kind of, maintenance, preventative. It's different, but the same as the other modalities, but this really gets at the fascia, which again, gets like really tight and brittle and those adhesions and those knots, and you really want to smooth it out.
Yeah. And I think we can all relate, as you start feeling certain areas of your body, you feel that tightness. And I think you made a good point of taking that stone and using it on yourself first. Like at the beginning, we were talking about using it on our jaw lines and coming back here, and you can feel it. And if I were to push really hard on that area, it'd be painful. And so I think it's good to gain an understanding of the pressure. So when you apply it to your dog or your cat, starting light. And then one of the questions that came up for me as you were talking is how many times do you go over that same area when you're working on, a tight area? Is it just until the pet seems more comfortable?
Yeah. So for maintenance, I say, like 3 to 5 strokes on each area as you're going from, head to tail, so that people can incorporate that, when they're watching TV on the couch before bed, that type of thing. When I'm working on a specific area, so again, TPLOs, for some reason, I have a lot of those on my calendar these past few weeks. But I will really, I will really work on that upper thigh, basically until I feel a little bit of a release, or until they feel better. And I'll use this tool, and then I'll use that Wildling Beyond Stone tool that has that serrated edge, and I'll do kind of like a back and forth, like scissoring or seesawing motion to really, release those adhesions. And you can essentially feel that release, or you can see, oh, there's a better range of motion on that limb. But I tell my clients to do, if they're doing it at home, probably like in a specific area, probably 5 to 10 strokes. Again, I don't want to overwhelm them, and they'll get the, really good benefits of smoothing out that area.
That's great. And I know for everyone that's watching this, you have amazing tutorial videos on Instagram. So make sure you're following Dr. Tori at Balanced Pet Vet. And of course, we'll share more information, but as she's describing things, I know I've learned a lot from just watching her videos and doing them on her patients and her own dogs. So leading into, are there any contraindications? So if you're at home, you're getting ready, and you're like looking at your pet and you're like, I'm not sure if I should do this. What would be some of the things that pet parents maybe should ask you for guidance, advice, or maybe hold off on trying Gua Sha on their dogs and cats?
Yeah, so anything on the skin that's abnormal, so, like hot spots, rashes, anything that looks red and irritated, I would stay away from lumps and bumps until you know what it is. Definitely talk to your vet about that. And then, as we talked about lymphoma, there's still some more literature that I want to really get the facts on, but I would just talk to your practitioner, talk to your vet about it before you do lymphoma, kind of depending on what stage they're at. So that's kind of the basic contraindications, but it's super safe. In humans, they scrape so hard that they bring up little like petechia on, or little like redness. We're not doing that with our animals. So if they have like a blood clotting disorder, if they're on blood thinners, this should be very safe and effective for them. So we're not going as hard as the human Gua Sha practitioners are. So if you Google that, like, don't freak out. You're not going to do that to your dog. But yeah, and also, like you said, if they're really sensitive in one spot, just move away from it or do less pressure, try it on yourself first. On human skin, you need to put like an oil or some sort of, moisturizer on before you do the strokes. But because animals have the fur and they have natural oils, you can just use it without oils. But I know you do essential oils, so I'm sure that you have some great pain relieving oils that you could, put on the dog before and then use that Gua Sha tool.
Yeah, I was going to ask you about that because, using things to help calm them too. So like frankincense is such a grounding oil and so safe when you're using the right brands. Mm-hmm. And then you have like copaiba, even lavender has anti-inflammatory and of course the anti-anxiety properties. So it's such a neat way to be able to integrate in all the different modalities, and you're getting the therapeutic benefits of both, which is so neat. So yeah, I love that you brought that
Yeah.
up.
Yeah, exactly. And I like, I'm curious to learn from you of like, hey, what oil should I use? So
Yeah.
yeah, that's definitely something that you can for sure incorporate. But if you don't have any, this will glide nicely along the fur. If you have like a doodle, that can be a little bit difficult. So I tend to like part the hair and go over, a little bit of a section, and part the hair and go over and do a little bit of a section. But even if you're just like going over the fur, you might have to do a little bit more pressure, but they'll still get the same benefits for sure.
So probably similar for like huskies and your double coated breeds and
Yeah.
things like that. That makes sense. So
Yeah, exactly.
So
Exactly.
actually, I just thought of thinking of hair. So you have your furless breeds, right? Your Rex cats and your like. So would they need oil on their
You
skin?
probably would. I have not come across a hairless breed yet, but yeah, I'm going to call you when I do and say, what can I use on
I
this
wonder,
cat? But for
that would
sure.
be interesting. Yeah. So you could probably use, I mean, you could probably use coconut oil, of course, as your carrier
Right.
oil, but argan oil would be also safe to use. Jojoba oil, like, yeah, no, that's I just thought of that as you were talking about fur. So that's super interesting.
Yeah,
They'd be more like a human at that point.
exactly. Exactly. And yeah, and you want it to glide smoothly. So
So less
yeah,
pressure probably for those ones too.
exactly. Yeah. Yeah.
Awesome. So what would be your top tip for pet parents? And this is kind of like summarizing all we're talking about. And if you're watching this live and you have questions, drop them in the Q&A box now, so that way we can ask Dr. Tori. But if there was one thing, or maybe there's a couple things, because I know how I am with like one top tip, but if there was like one thing that you wanted to impart with pet parents on how they can start this, what would be your number one tip for them?
I think honestly, it has to do with either the pet parent or, myself doing the Gua Sha. So, if you sit down to do it, or like I said, if you're on the couch, just kind of watching TV, like with each patient and with my own dogs, like I take a couple big belly breaths, and I calm myself down, because if I'm just like, and I've had days like this where I'm racing from one client to another, and I'm, trying to like, do all the things. And it's like, wait a second, they're feeding off of my energy. So with every time I start, I take a couple big belly breaths, and honestly, doing Gua Sha on my own patients, on my own dogs, on myself, it helps calm me down as well. So I think, yeah, the number one tip is like, don't stress about it. And when you sit down to do it, like just take a deep breath and just like connect with your animal, because it's a really good bonding time too. And you really can't go wrong. You're not going to hurt your animal. You're not going to like, be super rough. It's just like petting them, just start off with those like petting and doing those strokes with that tool. But it's just a good centering moment for yourself, for your dog, and for both of you together. So I think that would be my number one tip, is just to like take a breath and really check in with yourself and calm yourself down, because again, they feed so much off of your energy through the stone that you want them to get the benefits of it. And again, you really can't go wrong. Don't worry if like you go over like a hip bone, like it's not going to hurt them that much. You can kind of feel around and put your hand like on, the spine, and do it next to the spinal column, just because, that will help like avoid those bony prominences. But overall, it feels really good. And because I've done it on myself, and I've done like the body wash on myself. And I just say, like, don't be afraid to start. Just start really lightly and see what happens, and center yourself, and go from there. And ask me if you have any questions, or Dr. Katie as well. So
I
yeah.
love that. I love the whole grounding, and your energy plays such a huge part. It's the same with acupuncture, right? If I rush into an acupuncture and it's like the animal's going to be stressed, the human's going to be stressed, I'm stressed, and it just doesn't go as well. So, maybe that's where you can potentially diffuse essential oils too, where everyone
Right.
is, calming, and you're creating like a little kind of sanctuary and time to recollect and, have time together where you're helping to heal them. So I've actually got one question from Nadine. And so she has a Labrador that has lipomas. Should I avoid and Gua Sha around those, or could gentle strokes have any benefits over them, such as slowing growth? So I think you mentioned a little bit to this, but I'll have you answer that.
Yeah, I would go around them. It's going to be hard to go over them. And some, I believe you said it's a Labrador.
Yep.
Some of them can get really big, but I would go around them. I do have a couple of patients that do have lipomas. You know, they've been checked. They definitely are lipomas, and I go around them. None of them have grown in the past, let's see, year-ish. And so I was hoping that they would recede a little bit more. So maybe, you know, if you do this more often, you can report back to us, but going around them can help, in my opinion, just kind of arrest them or stop them from that phlegm, that stagnation from building up more of that lipoma. So it'll kind of help drain the bad stuff and bring in good stuff, and hopefully just stop that area from growing.
I love that. One of the other things that pet parents can use topically, so you're doing Gua Sha around it, but you could also use topically frankincense. So you can actually dilute it and take a drop and dilute it to 1% concentration, where you're using like just a teaspoon, 1 drop frankincense to a teaspoon of a carrier oil, and apply that topically to the lipoma. And you can actually do that a couple times a day. I mean, we can use a lot higher dosages, but I know a lot of people are wary of using essential oils and causing harm. But that's another way to kind of integrate both in together, and that might help shrink it faster too. Or even putting like frankincense on the stone.
On the tool.
Sure. Yeah. And then as you're running it along, you're getting those anti-cancer properties of the frankincense essential oil.
Yeah.
So it'd be super interesting to see how that would work for those patients.
I'm writing that down for myself.
I love it. No, I'd love to hear, like, you do. I mean, I don't do Gua Sha. I'm going to start implement. I'm going to try it on my cat, Moki, my cerebellar hypoplasia cat, because he's got a wonky back. Yeah. So he's kind of feral. I mean, when I say that, he's not feral, but he's like very sassy as a cat. So his level, like, it's very low of tolerance. So it'll be interesting to see how he does and incorporate that, because I have the Beyond Stone from Wildlife. Yeah. And so maybe integrating that. He'd probably do better with rose quartz, it sounds like, but yeah, I'll definitely have to try that on him. So that was really awesome, Dr. Tori, and I learned a ton, and I hope everyone here learned a lot. Like I mentioned, I will send out the recording to everyone in case they weren't able to join live. I see one question actually from Nadine also. I love this. It sounds like she's super excited about this, which I love. So thanks for your suggestions. Is it okay to Gua Sha on the belly and abdomen area, or just outer body? That's a great question.
That is a great question. So if you're going to do the belly, I would do it really softly, or obviously not as deep pressure. A lot of dogs, I have one dog actually that has like constipation. So I will do it in up the right side, across, and then down the left side, kind of in the what am I trying to say? Like the order of the colon. Yeah.
Yep.
Yeah. So it depends on kind of how you're sitting.
Yep.
But just make sure it is your dog's right side. So go up the right side, across below the rib cage, and down the left side. So I would move in that direction, and just do really light pressure. You could do a little bit, and I don't know how your dog would tolerate this, but if you have a dry brush, you could do some dry brushing on the belly. That can like help stimulate everything. So if you're nervous to like use pressure, you could do like a body dry brush along the belly as well. But yeah, you can definitely do that. Just do a lot lighter pressure.
I love that. Also, cats with constipation, right? I mean, yes. We use acupuncture, but not every cat will accept acupuncture. So
yeah.
Oh, that's a great idea. I love that.
Yeah. So, and probably with cats, I would do just because like I'm a little bit nervous, probably like, well, maybe I wouldn't do the dry brushing.
I wouldn't tolerate dry brushing.
I would maybe do like manual and see how they do. And then you could try a little bit with the stone, or have the clients do that at home.
Yeah, that's great. All right. So I'm not seeing any other Q&As, but Dr. Tori, okay, where can everyone find you? I know you help clients, you help patients, you teach them how to do it. So I want to make sure everyone has the information on where to find you. So share it all. I know you have a lot of resources.
So balancepetvet.com, you can find me there. And I do have Gua Sha tutorials there that you can watch, and that might be a little bit easier to follow. And besides me just kind of trying to talk it out to everybody. And on social media, Instagram and Facebook, I'm Balance Pet Vet. I try and post, videos of me doing some Gua Sha and some other tips there as well. So yeah, Balance Pet Vet kind of across all social media.
I love it. And everyone, if you're on social media, you do need to follow Dr. Tori. She has not just Gua Sha tips, but tips on how to help your dogs and cats overall health naturally, which is what we love so much. So is there anything else that you want to leave everyone with today, Dr. Tori?
Yeah, I just think, like start today or start when you want to start or, there's minimal downsides. And if you guys have any questions, like, please feel free to reach out. Again, I love this stone. Even if you're just going to try it on your own face first or your own body first, I really do think it is like a calming mechanism, and it can really help, I feel like everybody's stressed out all the time. So just, start, don't overthink it and start and let me know if you have any questions.
I love it. And I know someone just posted the final question, more tutorials with cats, please. I know we need more stuff for cats. So
I know.
If I get Moki, I'll share the video with you, depending on how it goes.
I know. And it's so hard. I don't have a cat at home, but I will, the next cat I get in here, or maybe the clinic cat, I will try to get him to cooperate.
Awesome. I love it. Well, thank you so much for taking time out of your day, Dr. Tori, and teaching everyone about it. So once again, I'm Dr. Katie Woodley, the natural pet doctor, and Dr. Tori Countner. Check her out at Balance Pet Vet. If you need help, guidance, her tutorials, use her telehealth consults to get more information and guidance. That's what she loves doing it, and she's great at it. So thank you again. I truly appreciate it. And
of course,
everyone have a great rest of your day. And thank you for taking time out of your day to learn more. All right. Bye, everyone.
Bye.